Cocaine is the second most commonly used illicit drug in the United States. According to the 2005 National Survey on Drug Use and Health, 2.4 million Americans aged 12 and older used cocaine, and 700,000 Americans used crack during the month prior to the survey. Cocaine is the most powerful natural stimulant drug known.
The two types of cocaine are crack and powdered cocaine. Powdered cocaine can be snorted or injected, and crack is smoked.
Many users say that taking cocaine or crack gives them a high or a feeling of excitement. At first glance, they may feel as if they are more awake and that they have more energy. They may also be more talkative than usual and feel more confident.
When the effects wear off, users tend to experience many unpleasant feelings. Using crack or cocaine speeds up some of the reactions inside the brain, which causes changes in the body and in the way a user feels or behaves.
Some medical consequences of cocaine use are heart attacks, reduced blood flow to limbs, chest pain, respiratory failure, strokes, headaches, abdominal pain, nausea, nosebleeds, and loss of smell. And if a mother uses cocaine while pregnant, the child can have major birth defects.
And of course, with any drug, the ultimate consequence is death.
And if that wasn't enough, the psychological effects of cocaine use are depression, anxiety, irritability, aggression, restlessness, confusion, and hallucination. According to the Drug Abuse Warning Network, cocaine-related emergency room visits increased by 47% between 1995 and 2002 in the United States. Cocaine or crack can cause sudden death. There is no way to predict who will die in this way. Most deaths from cocaine or crack use are due to overdoses that lead to heart failure or strokes.
An overdose happens when a person takes more drugs than the body can cope with.
Cocaine and crack are illegal drugs. It is illegal to make them, sell them, give them away, or possess them. Governments around the world impose strict penalties for these crimes, and a conviction for a drug offense can seriously affect a person's future. Not knowing the laws is not an excuse that can be given in court. Governments have passed strict laws that send out a clear message that cocaine and crack are illegal, but what else can be done to prevent cocaine and crack abuse? Communities, schools, and governments all have to work together to tackle this difficult problem. It can be very hard to quit crack and cocaine because people can develop such a strong dependence. Fortunately, there is a lot of help and support available for people who want to break free from crack and cocaine.
Many of these people find counselors and group therapy helpful.
Your decisions about drugs can affect the rest of your life. At some time in the future, you may find yourself under pressure to take cocaine or crack. You may not want to try them, but explaining that to a persuasive friend or dealer may be hard. It's a good idea to plan ahead for how you will cope with that situation. There are a number of organizations that provide information and advice about cocaine and crack. Some provide information packs and leaflets, while others offer help and support over the phone. You can contact the American Council for Drug Education at 800-488-3784. You also can contact DARE America at 800-223-DARE. Finally, you can contact the National Youth Crisis Hotline at 800-448-4663.